hypoxia or critically ill or severe respiratory problem or in case of cardiac arrest or cardiopulmonary resuscitation. How can we give oxygen to the child? We want to know the equipment name and how much concentration of oxygen is given. At first, the face mask. This is the face mask. How much oxygen the face mask is given? It gives 50% oxygen. So I cannot use the face mask in the severely distressed children, in which I should use the non-rebreather mask. It is a face mask with reservoir below, which will increase the oxygen concentration up to 100%. Okay? So oxygen mask give 50%, non-rebreather mask give 100%. Then we can use the Venturi mask. What is the Venturi? It is a plastic piece which give oxygen with different concentration according to the indication. For example, the green one gives 60% oxygen, the red 40%, and so on. So I will choose the right piece according to my indication. Third method is to give by a nasal cannula. The nasal cannula is give 40% oxygen. So it is used for the mild cases. And it connected to oxygen flow from 3 to 5 milli per minute, not more. Because if I will increase the oxygen flow, it may cause necrosis of the nose and the nasal sac. The oxygen tent or the head box, which is preferred method for pneumonia and lung problem because it gives 100% oxygen. Finally, the ambu bag. The ambu bag is give oxygen with pressure. So it is used when the patient is apneic or bradypneic. I will give the oxygen and pushing it by pressure of my hands. The ambu bag is formed of a mask which will cover the nose and the mouth, a pressure valve which when closed gives 40 per centimeter water pressure, not more, to avoid pneumothorax and rupture of the lung. The self-inflating bag, which is different sizes, neonatal and the children and adult, and a reservoir to concentrate the oxygen. The ambu bag with reservoir give 100% oxygen. The ambu bag without reservoir gives 50% oxygen. So I should to know the equipment and how much oxygen it gives in the exam. Second thing which may come in the exam is the MDI uses in asthma children, in asthmatic children. In asthma, we use inhalation therapy in the form of either nebulization or MDI puffs. Nebulization, we can put nebulizer on the patient mouth and nose and give drugs like salbutamol, epinephrine, atrovent, and so on. All of these drugs stimulate the beta-2 receptor, produce bronchial muscle relaxation and the bronchodilation. The nebulizer should decrease the size of the molecular particles of the drugs from 0.8 to 3 microgram to allow it to reach to the lung. If it decreases the size more than 3 micron, it will not reach the lung and precipitate in the trachea and the mouth cavity. The second method is to give the drug by MDI, which is the metered dose inhaler. This is the MDI, which can be puff the drug directly into the mouth or using a spacer in cases of infant and children. The spacer may have a mask put on the mouth and the nose of the child, or may not have a mask and the child is put his teeth over the opening of the spacer according to the age of the child. This is the spacer. This is the MDI, which consists of a cover cap, covers its opening, and a stick or a piece which we push on it to deliver the drug. The MDI should be held in this manner, in the upside down direction, and put this piece in the mouth of the child or in the spacer, like we will see in the video later. It can be used in asthma and in COPD children. There is examples of MDI, many examples in the market, like Atrovent, Fustilar, Salbutamol, which has beta-2 agonist, or Clinil and Flexotide and Seretide, which has steroid, or mixed like Vintal composition. Question in the MDI: at first, identify the MDI and the spacer. Second, which drugs is put inside the MDI, either beta-2 agonist or inhaled steroid or mixed. The indication used in acute asthma exacerbation and in maintenance therapy of asthma. Examples, like we said, Atrovent, Salbutamol, Clinil, Flexotide, which is a trade names of MDI present in the market. Checklist for MDI inhaler, we will see it in the video.